So I knew I wanted to become a physician when I was a graduate student at UCI. I was studying biomedical engineering at the time, and through that program I got access to seeing what a physician's life was like on a day-to-day basis, seeing them in clinics, seeing them in the OR. And I knew at that point I wanted to do something a little different where I could make a meaningful impact in people's lives on a day-to-day basis. My grandfather was an OB/GYN in Taiwan, and he would used to tell me stories when I was little about deliveries that he would have or patients that he would encounter. And he was a very inspiring, figure in my life. He would talk about, patients that were too poor to be able to afford to see the doctor, and he would say, just come and pay whatever you can. And so that was really inspiring for me, and sort of set my moral foundation and things that I believe in. But it didn't really materialize for me. I just thought, he was just telling stories about his past, and I didn't really think it was applicable to my life until I got exposure to clinical medicine, and I decided that's what I really wanted to do. I enjoy the variety in women's medicine. You're able to take care of women all different stages of life. So you can be seeing a teenager in the office, talking to them about contraception and how to keep themselves safe. You can be talking about to an elderly lady, helping them with abnormal bleeding or any problems that they might have, helping them transition through menopause. Or you could be seeing a pregnant lady for the first time with their first pregnancy and the excitement of that, and helping them navigate through the challenges and joys of pregnancy. When I was a medical student, I remember being on the labor and delivery floor for the first time and getting exposure to what that was like. And I remember having a woman in labor, and she had had a very challenging pregnancy that was very different from what she had expected. And then just helping her navigate through that. And then finally, when she finally delivered a healthy baby, and just being there in that moment where the parents would enjoy that first moments of bonding with the baby was just so special. I knew at that point that's when I wanted to do OB/GYN. In my spare time, I love to spend time with my family. I have a young son, and we came from the Midwest recently, so we love enjoying time in the outdoors. Now that we're back in Southern California, I can take my son to the beach, which is very exciting, but I also love to take him to the parks, to any local fairs or the pumpkin patch. The three words that would describe me would be calm, patient, yet passionate. If I encounter a situation that I've never experienced before, I try to see if I can find the answer in the literature. There are great databases out there with the most recent studies about a certain topic that I'm interested in. There are also publications put out by our society regarding different topics, and they also put out journals as well. Or, I would just find one of my colleagues. I mean, we have so many physicians in our group. There's a wealth of experience amongst all of us. I'm sure somebody has encountered the situation before. What I think makes OCWMG very special is that we have a great team of physicians. We are a large group. We also have a lot of support staff as well, and I think everybody together works as a team. We're one big family. Everybody pitches in their own way, from the person who does the lab draw to the receptionist at the front desk. We're all committed to making sure that the patient gets the best experience possible.